He was there to give hope to his dying COVID patients suffering excruciating pain and misery isolated in sterile hospital rooms. Sometimes, Dr. Thomas Yadegar, along with the medical team at Providence Cedars Sinai Medical Center in Tarzana, held the hands of the dying throughout 2020 when loved ones were turned away to avoid spreading the deadly virus. In the early days, medical teams weren't sure what they were dealing with. Consequently, they restricted the outside world from entering hospitals as dozens of patients died daily. One code blue after another was called. I recognize, along with our nurses, that one of the worst parts of the pandemic was that our patients were dying alone, Yadegar said. I always thought that our patients received hope from their family and loved ones. I didn't think that we, as healthcare providers, were able to provide them hope. Hope is the one thing I cannot replace with medication. I recognize even as doctors and nurses we can give our patients hope. They are not alone in fighting their illness, or their journey, even if that means you are at their bedside and you hold their hands as they take their last breath, Yadegar said. Having patients say goodbye over Zoom, an online video chat platform, took an emotional toll on the hospital staff. It just seems like this virus, as deadly as it is and as much havoc it caused, our fear and our response to it is far worse, he said. I think by not allowing family and loved ones in the hospital to see what was happening and to be with their loved ones and to give them a fighting chance, to give them hope, to get them to keep pushing themselves, I think we did far more damage. Yadegar serves as the Director of Hospitalist Services, Pulmonary Medicine and the Intensive Care Unit for the hospital, and also operates a private pulmonary practice across the street.